EMS week this week, and each and every day on Daytime we are focusing on a different aspect of emergency medical service. And today we're speaking with Guy Beauchemin from the Ottawa Paramedics. Thanks so much for being here.
Good morning.
So where did you do your training? Is it right here local in Ottawa?
Right here in Ottawa, Algonquin College and Cité Collégiale provide the course as well.
Okay.
It's a 2-year course, and then and that includes from anatomy, physiology, studying, and then field training as well.
It must be pretty intensive. I mean, you folks are the first on the scene.
It's a very intense program, and it's expected from the students at the beginning. From about 70 or 80 of them that actually register at the beginning, to and they end up with about half that actually succeed the course afterwards.
Now, one thing I didn't realize, Guy, before the show you were telling us, there are different types of paramedics, and you can tell by the bars on their shoulder, right?
We try to keep it pretty straightforward for the public.
Yeah. So you've got the one bar. What does that mean?
The one bar is a primary care paramedic. So your basic paramedic.
Okay.
And then we have certain orders that we can follow. If you hold that board up, I'll show you real quick.
Sure.
So these are some of the drugs that we can administer. Glucagon for diabetics, nitroglycerin for heart pain, chest pain for oxygen therapy, Ventolin for asthma, aspirin as well for cardiac, and then the oral glucose at the bottom left there for diabetics, and epinephrine for allergic reactions, that kind of thing.
So when you go out in the truck, in the ambulance, to the scene, you're accompanied by someone else as well.
That's right. Yeah, there's 2 of us. I work with a advanced care paramedic.
Okay.
And we take turns between calls and driving. And if there is an advanced care call, then that's when she takes over.
All right.
Okay.
So let's focus on primary care today.
Yeah, for sure.
Because you brought along some fun, quote unquote, equipment
Oh, yes,
that we're going to be playing with today. I said quote. What are we looking at here?
This is our defibrillator. This is the main piece of equipment that we use, one of the primary pieces. And it's called a defibrillator due to one of its main tasks for defibrillating a heart that's not pumping, able to shock it and hopefully bring it back. And that's done with these pads here. You sometimes see on TV they use the paddles.
Right.
We use these. They stay on the patient.
Okay, so this is the same idea as the paddles you always see.
Exact same thing.
Like the
Okay.
paddles, meaning those 2 electric
Yeah, you see them clear
Yeah.
and they shock.
Yeah,
Same
okay.
thing.
This is the same
There's not
thing.
as much drama on TV if you just throw the pads on, you know, and go stand back, right? They got to do the greasing up.
That's right. That's right. So these are all pre-done.
Okay, and we're going to be doing a demo on Derek here today.
Yeah, we'll do a quick call an ECG, electrocardiogram.
Okay.
And gives an idea of what's happening with the heart.
Good.
And when you turned this on, it actually said, please place pads on, right?
Place pads. There is some parts of the machine that'll kind of coach you along.
Okay.
Kind of remind you.
Excellent.
So what do we need here?
So these are pretty easy. There's just 4 of them.
All right.
Have you, Melanie, put them on.
Oh, I got
Oh, well, wouldn't you know.
My goodness, here.
Get ready, Derek.
You're just going to get 1 under each shoulder.
Okay.
With that.
All right.
So in an emergency situation, obviously this wouldn't be happening. You'd be ripping the shirt off.
Oh, for sure. Scissors, tearing it off.
Absolutely.
Yeah,
I'd be yelling, no, that's my med shirt.
Okay.
That's fine. That's good.
That's good?
All right,
That's good enough.
Okay, so there's
So
no...
have you put the first one on.
Let me move the
Just peel
mic
that
here.
off. And there's your
Now,
gel.
this is
Don't be
sticky.
intimidated at home, fellas.
So
go with
where
the
am
top
I?
right.
Top right?
Yep.
So right above
That's-
here?
that's
okay,
fine
can we
there.
get a shot of that? Can you hold that there?
Okay,
you go.
I've got a
There we
mic
go.
issue too, you know.
Oh, I beg your pardon. I'm sorry. There you go. Now,
Right.
that's going to hurt when I yank it off.
When you yank it off, yes.
Yeah, you're going to love that, aren't you?
Sorry.
There's
I
the black
should
one
have
for the
done
other side.
waxing.
So the purpose of doing this is you're suspecting he's
Just to
having a
monitor-
heart attack, or?
Yes. And to
Okay.
monitor the heart.
Okay.
Okay,
So I'll
got
let you
it.
put this one just down on the side, just
On the
past his
side,
hands. Yeah,
here?
that's perfect.
Oh.
All right. Is that cold?
That is cold, yeah.
I put my fingers in ice water.
Oh,
Is
nice.
that-
That's going
Very
down on the
good,
other side.
Very good.
Oh, they are
Same thing.
sticky. Sorry, Derek. That's going
That's
to hurt.
okay. That's all right.
There.
Okay. I'm all set here.
So that's
and-
one of the things we can do. The other thing, I'll just borrow a finger from you.
Okay.
That's to measure his oxygen in his blood.
All right.
Oh,
So we can see on the screen.
Is that okay, that noise?
it's beeping.
Is that too much? Yeah,
No,
that sounds
I'm
pretty good. No,
Okay.
that sounds all right.
Well, he's alive, so that's a good sign.
Yep.
But normally, is the person unconscious when you're doing this, or are they actually speaking, breathing,
No, normally
talking
conscious.
to you?
If they're having problems in their heart, if we want to, even if they aren't, we just want to make sure just to make sure that there is nothing wrong.
Right.
Okay, got it.
And that'll give us an idea with a basic ECG. The nice thing about this machine as well is it's showing a heart rate as well as the...
Oh, it's giving me a, the little
Oh,
printout,
sorry.
right?
Yep.
Look at that.
So
I'm getting faxed.
how's
Probably
he
the
doing
Prime
with his
Minister.
heart here?
And so far, everything's fantastic.
Yeah, I look good. I'm looking
Yeah, that
pretty
looks
good
very
there,
good.
yeah. That's normal.
So does, I imagine then every ambulance, every paramedic has this equipment?
That's right. In every vehicle, there is a defibrillator, and they're state-of-the-art equipment. They're fantastic.
Holy cow, we're down to 30 seconds
Down
already?
to 30 seconds
cow.
already. So what would we need to do
the blood
next?
pressure cuff as well. So we
All
can
right.
take your blood pressure.
Yeah, okay.
And then the
So-
next advanced is we do a 12 lead and able to tell for a STEMI program
Right.
and able to go directly to the Heart Institute if they are having a heart attack and detour completely the emergency department.
It's so great to
Fantastic.
have
It's
you
been,
folks here and have
it's
this service
fantastic.
in Ottawa.
Thanks a lot,
Guy,
Guy.
so much
Thank
for
you.
being here. Tomorrow we're going to be focusing on advanced care. I wonder what
That's
we're going to
right.
be doing to you then.
What am I getting hooked up to tomorrow?
Okay, we'll be right back after this with our favorite life coach, Helen Daniels. We'll be right back.